we have several risk factors that can cause erectile dysfunction and other factors that can directly cause erectile dysfunction. And like I said, having erectile dysfunction is a warning sign, for example, a present or future heart disease or stroke. So you find that the risk factors for heart disease are similar to the risk factors for erectile dysfunction. So for example, obesity. Not only does obesity increase your risk of diabetes and other conditions that cause erectile dysfunction, but it can also cause low testosterone and depression. Diabetes. If you have high blood sugars over a long period of time, that can lead to damage in the arteries of the penis and the nerves as well, which means that you might have difficulty getting an erection as a result of reduced blood flow to the penis. With high cholesterol, you get what we call these lipid plaques that are deposited in the arteries of the penis, and if these lipid plaques are not dealt with on time, they actually become hard like cement, so difficult to get rid of, which means there's again reduced blood flow to the penis. The arteries become hard, which means that they do not dilate, so therefore you cannot get an erection. And this is also a sign that there might be lipid plaques elsewhere, such as in the carotid arteries that lead to the brain, as well as in the arteries of the heart. Smoking is another factor that reduces blood flow to the arteries and can encourage the deposition of lipid plaques in the arteries. Lack of exercise. As we know, exercise helps to increase blood flow. It burns down the fat, you get weight loss. It also breaks down the lipid plaques, and exercise helps to reduce your blood sugar levels. So lack of exercise means the reverse of all these factors, which then causes erectile dysfunction. With high blood pressure, imagine that your heart has to pump blood at a high pressure all the time. This is not sustainable, which can also cause damage to the smooth muscle of the penis. Now, let's not forget about low testosterone. Low testosterone is an important factor in erectile dysfunction. It can cause a low sex drive and is also linked with other conditions like type 2 diabetes and obesity. So if we look at other conditions like spinal cord injuries, damage to the brain, back pain, multiple sclerosis, Parkinson's disease, thyroid problems, as well as several other factors that can cause erectile dysfunction. Then you also have medications such as your blood pressure medications, for instance, which are meant to reduce your low blood pressure, but they have side effects of causing erectile dysfunction. However, you do need to be on these blood pressure tablets as the benefits outweigh the risks, because high blood pressure can also cause erectile dysfunction. So it is worth speaking to your GP, who can now put you on a different version of a blood pressure tablet that's less likely to cause erectile dysfunction. Also, antidepressants that help with anxiety and depression can also cause erectile dysfunction because they reduce your sexual libido as a side effect of the medication. Finasteride, known for hair loss, can also cause erectile dysfunction as it reduces the free testosterone in the body. However, the effect of finasteride can be reversed after stopping the drug. Then you also have recreational drugs like cocaine, marijuana, as well as anabolic steroids that are used by athletes and bodybuilders, as well as drinking too much alcohol. Then you've got cancer treatments like radiotherapy for prostate cancer, or surgery to the prostate, bladder or bowel, which can damage the nerves and cause erectile dysfunction. You find that in the majority of young men, especially those under the age of 40, there tends to be no medical problem, and a lot of it is actually psychological. For example, watching porn, depression, stress, anxiety, relationship difficulties, and even performance anxiety during a relationship can all lead to erectile dysfunction. I do get a lot of teenagers as young as 15-year-olds asking for Viagra, and really, at that age, I would normally advise that you should be focusing on your studies. But even with these young teenagers as well as young men, one of the questions I do tend to ask is, what are you watching? And in most cases, the answer is they're usually watching excess porn, or they're masturbating, or they're in other relationships apart from their partners. Also, you have to remember that you have to have a sexual desire towards your partner. Being physically attracted to your partner is very important for erection. Other factors like stress to do with the mortgage payments, bills, school fees for the kids, can also cause erectile dysfunction. If you are still getting early morning erection, then that's usually good news because it's most likely to be a psychological problem. But if you have no early morning erection whatsoever, then this could be an organic cause, which might be due to damage to the nerves, the blood vessels, or smooth muscle, which can be irreversible in some cases. Also, if you lose your erection suddenly, then this is most likely to be psychological, as opposed to if you lose your erection gradually, which might be due to a medical problem. But do remember, you can have a combination of both medical and psychological factors happening at the same time. So this is why you should not just buy over-the-counter drugs, and you should see a doctor, as these problems might need investigating further. So your doctor would want to check your cardiovascular examination, listen to your heart, check your blood pressure, as well as examine your genitals for conditions like Peyronie's disease, which is abnormal curvature of the penis, checking the size of your testicles, if they're small, if they're undescended. And to remember, small testicles can occur at birth, and it can also be due to taking anabolic steroids, which means not enough testosterone is being produced. Also, you might need a prostate check, which is usually done in men who present with urinary symptoms such as reduced stream or increased frequency of urine. So depending on the suspected cause, you will need several blood tests. So for example, an early morning testosterone is usually done between 8 to 11 a.m. because after this time your testosterone levels actually start to drop. If it's low, they're usually repeated to confirm, and they are done along with other tests such as your LH, FSH and Prolactin, and it actually tells us if this is due to a higher level in the brain, such as if it's a pituitary problem. As we mentioned, you want to check for your risk factors such as checking cholesterol, checking for your blood sugars and checking for your thyroid. So depending on the outcome, your doctor can actually treat these problems or refer you to a specialist for further tests. So if it's low testosterone, you might need a testosterone replacement therapy or even a referral to an endocrinologist. If it's a prostate problem, then you might need a referral to a urologist. If it's a heart problem, then you might need a referral to a cardiologist. Now, I hope you found this video on erectile dysfunction useful. And if you like this video, please feel free to subscribe to my channel.